So today I did a unilateral breast reconstruction, and I don't do much of this in Los Angeles. Most patients opt for both sides. So what's the benefit of only doing one side? So if you're being treated for breast cancer, you will meet with a breast surgeon or a surgical oncologist who will discuss with you options for treating that cancer. And that's going to include usually a lumpectomy or a mastectomy. Lumpectomy is where we take a piece of tissue out but leave the breast for the most part. Mastectomy is when all of the breast tissue is removed. Now there'll also be a discussion with you whether or not you have increase for breast cancer on the other side. So your surgeon may or may not recommend that you have a mastectomy on the other side as well. So you may be recommended a mastectomy on both sides for medical reasons, so to reduce your risk of breast cancer on the contralateral or other breast. Now, many patients choose to have a mastectomy on the other side even if they don't have significantly elevated risk for aesthetic reasons. So here's the benefit to keeping the other side and not having a mastectomy. So you have your natural tissue and you have your normal sensation. So you're keeping one of your breasts with normal sensation, and that's very meaningful to a lot of patients. Another potential benefit is being able to breastfeed. So sometimes patients are still hoping to have children after breast cancer treatment and would like the opportunity to breastfeed, and by not having a mastectomy on both sides, they may have that opportunity. Many women choose to do mastectomies on both sides even if they don't have a medical recommendation from their oncologist or surgical oncologist for aesthetic reasons and personal reasons. And we're supportive of that. So for personal reasons, some women just don't want to worry about breast cancer on the other side. They don't like to have screening mammograms. They just don't want to worry about it, and that's okay. Aesthetics is also a big reason why women choose to do both sides. So it's much easier for me as a plastic surgeon to have both things the same versus a natural breast and a reconstructed breast. They tend to age differently and behave a bit differently with time. And so you tend to fight asymmetry more, of course, when you have different things going on each side. So it's always important to remember it is not one size fits all when you're going through breast cancer treatment. All of these things matter, and your personal preferences matter too. So you should talk these out with your surgeon to figure out what makes the most sense for you.